Hello, welcome to Tech Roundup with me, Dr. David Pugh.
And me, Dr. Laura Bez.
Biosensors are changing the way that diseases are diagnosed, both in hospitals and at the point of care. The new report from IDTechEx, Biosensors for Point of Care Testing, predicts that by 2027, the biosensor market worldwide will be worth $33 billion. Now, Laura, you were the primary author on this report. What can you tell us about point of care? What is point of care for the layman?
Okay, so point of care really, IDTechEx puts two definitions to be a point of care biosensor. And that basically means that when we do a test on a biosensor, we get a sample to answer time, so like a blood test, within 1 hour. And also the device on which we're conducting this test really needs to be portable. We need to be able to lift it up and move it around to truly be called a point of care device.
So one of the biggest examples used today would be glucose testing, where someone can carry a handheld monitor with small biosensor strips.
Absolutely.
Okay, that's really interesting. So what are the new applications for point of care? What are we expecting to see over the next 10 years?
Well, as you say, something like glucose testing holds the biggest market share for point of care biosensors at the moment. But as time moves on, we're moving away from doing such things as testing for glucose to conducting more complex tests at the point of care. So what we're seeing the advent of at the moment is something called molecular diagnostics, which is being able to perform genetic tests at the point of care, which are incredibly useful for testing for things such as infectious diseases. But also, as time goes on, we might be able to look at, say, whether you're likely to have an inherited disease or a particular type of cancer and things like that. And before this point in time, it simply wasn't possible to conduct such tests at the point of care. Your blood tests, say, would have had to have been sent off to a centralised lab, the results done, and then it was given back to you. So we're at a bit of a change in the market currently.
So molecular diagnostics is not a new term, it's not a new assay, so to speak, but it's moving from something that was a huge hospital-based test to something that's more portable. Is that correct?
Yes, that's correct. So molecular diagnostics has been used for decades now in diagnostic testing and is considered really the gold standard of doing a lot of diagnostic tests. As you say, the difference is it's not taking a trained person hours and hours in a lab. Really now we're looking at handheld devices where you can put a sample in, say a cheek swab or some saliva or some blood sample, and you can get a result in, say, 10 minutes, 15 minutes. So this is really revolutionising the market.
So how long do you think till we see these devices at the point of care, at our bedsides, being able to do these tests really quickly and easily?
Well, there are some already on the market, but this year and next year really see a whole host of devices that have gone through regulatory bodies and they're entering the market. So the take-up, we think, will be pretty swift, especially in the areas of infectious disease testing, where it's going to be very, very valuable. But we can expect this to happen with, say, the next 5 to 6 years, we'll see a widespread take-up.
Fantastic. And you can find out more about the report and more on biosensors in general at www.idtechex.com/biosensors. Now, if you'd like to know even more, IDTechEx will be hosting their first UK-based business technology innovation forums in Cambridge on the 5th, 6th and 7th of December. Now, we'll both be speaking in those forums and you'll be able to find out more in a session on biosensors, as well as printed and flexible sensors, IoT, human-machine interface and many more. You can find out more about this at www.idtechex.com/Cambridge17. And until November the 3rd, you can get a 10% attendee discount.
So to find out more about these Cambridge Innovation Forums, please go to idtechex.com/Cambridge17. And if you would like to find out more about the report, please go to idtechex.com/biosensors. As always, for more information on our research, please go to idtechex.com. And you can also find us on Twitter. David, where can we find you?
You can find me at Dave Tweets Tech.
And you can find myself at Laura Bez. So until next time, thank you very much.
Bye.